EMS 1 and Medic 34 respond for a report of multiple overdose patients at the same location. SPSO is now requesting 2 additional ambulances.
This is the worst loss that you could ever imagine. And you wouldn't wish it on anybody else. And if there's one thing, we can do, having lost, especially in my case, someone way too young, is to, try to address the fact that it's continuing.
Opioid-involved deaths are skyrocketing in the United States. On average, 115. That's right, 115 Americans die every day from an opioid overdose. So what does this look like in San Luis Obispo?
A few years ago, when we looked at the data of overdose rates, we're higher than the state average. So are we more in a crisis than other counties? Probably.
To be exact, according to the CDC, from 2014 to 2016, SLO County's overdose deaths were higher than the national average.
Okay, well, our county has an issue.
But recently, there's been a change.
In 2017, our overdose deaths related to opioids actually went down, which is the first decrease that we've seen since 2006 is when we really started seeing everything increasing. So that's a really huge success. Still more to be seen, okay, is this an actual trend? Is it like a weird blip this year?
What is causing this decline? Well, we don't know. What we do know is that SLO Banger's syringe exchange program received a state grant for 686 Narcan nasal sprays.
I really strongly believe that the syringe exchange program has been instrumental in reducing overdoses because we are really at the front lines of the folks that are actively injecting drugs and experiencing the overdoses. So getting naloxone kits into that community, I think, has been huge.
Basically, SLO Bangers provides users a safe place to dispose of needles while also preventing the spread of blood-borne diseases like HIV. And in the case of an emergency, Narcan can reverse an overdose.
So naloxone is the active ingredient. Narcan is like the brand name. So it comes in many forms. There's an intramuscular version form that you put up in a syringe and you can put in your arm, your thigh, or your butt. There's a nasal form that's much easier for people who maybe aren't syringe users.
It's like an undo button, Hopefully it would be kind of the start of their path to treatment.
Unfortunately, a lot of the war on drugs does more to harm the people using drugs instead of heal them. And that is what we need to change. And naloxone is the first step, which is just keeping people alive.
Dr. Starr says addiction is rooted in prescription painkillers.
I had a back injury, I had a car accident, I broke my wrist. I had pain pills that they gave me, which seemed like a reasonable thing to do, but it got refilled, and then it got refilled, and all of a sudden, 60 days, 90 days go by, and you've got a pretty full-on addiction going. And they switched to heroin, which is cheaper and more readily accessible.
People under the age of 30 are dying every day from accidental overdoses. And we're not outraged. I mean, if that many people were dying from Zika every day, we'd be scrambling. But we're not. And I think a big piece of it is stigma.
It's not just homeless people on the street shooting up, but it's like your friends and your people who are high functioning, right? Professionals and working, and there's a lot of pretty high functioning people with substance use problems, right? Who are just barely hanging on.
We're dealing with a problem of stigma and social isolation and poverty potentially, and mental health and mental illness that can all kind of come together to make it more complicated. And that I think that medication-assisted treatment together with kind of behavioral therapy has been shown to be very effective.
There's no here's a blue pill, it's solved. It takes everyone. It takes everything. It takes the whole community. It takes doctors, police officers, mothers, parents, hospital workers, social workers, treatment providers, public health officials. It takes all of us, if we really want to address it, to collaborate and do better for our community.